Boy, when you talk about innovation and someone with a 30-year track record, it's a little hard to think about those two things together. It's great to be here. Dean Stern, Dean Washington, thank you for the invitation. Provost Gilman, it's nice to see you as well. Okay, healthcare. How many of you in this room would like to be as healthy as you can possibly be? Okay, good. How many of you are? Okay, there'll be a test later. I'd like to share a couple things with you today about a new way of looking at the healthcare system. And we're going to, when I went to school, I studied computer engineering and business and accounting. I was both a nerd and a geek. And so there's hope for everybody in this room. And I want to talk to you about a new category of what we call health optimization, which is different than anything that's really been done in healthcare before. How we tie that to incentives and rewards so that those of you who would actually like to be your healthiest, and with healthcare being 19% of the gross domestic product in the United States, it seems like we should make investment to make that happen. And I'm going to talk very little about the products we're producing at Welltok, but I just want to show you one vignette so you can get an idea of what we're up to. So I want to share a couple things with you. First of all, how many of you have doctors? Right? How many of you are patients? Are you? What percentage of time do you spend in a clinical setting during the year? All right. I want to tell you right now that consumers are not patients, healthcare consumers. Consumers make choices. Patients receive care. Okay? An engaged patient is compliant with the treatment regimen. An engaged consumer is accountable for their health status and for the cost of their health care, and often proactive in creating that. Now, that seems maybe common sense to you, but consumers are extremely confused. And I'm going to blow this picture up for you in a second. But you could be a physician in the healthcare system for 35 years and have no concept of how the healthcare system works. You can be an executive in an insurance company and have no concept for how the healthcare system works. It's so vast and it's so big, most people only see their piece of it. Okay, and the thing about consumers is each of us, even though we might find someone who's a lot like us, we each have different needs. And so when we start to transfer from how healthcare works to the use of technology, I'm going to talk to you about the issue of personalization in technology. Because unlike most B2C platforms, business-to-consumer platforms and technology, one size fits all or a common great experience will not work in healthcare for a variety of reasons. This is you. Sad to say. So here's what happens. You're born. You hit your prime. You roll along for a little while. You start getting a little older, doing things, and you start slipping down this, what's called the morbidity curve, until you asymptotically meet your end. That concludes my presentation. Thank you. Now, most of what we've done in healthcare is really sick care. These little red lines: break a leg, have a car accident, have a baby, have a curable bout of breast cancer, or have a heart attack, right? And almost everything we do in healthcare is the practice of medicine that tries to return us to the green line, right? Does that make sense? Now, I happen to have been born with a condition which results in a disease called Crohn's disease. So my morbidity curve may look like this, okay? If you're Gerald Solomon, he's a little healthier. His morbidity curve may look like this. And if you're Dean Stern, you might look like this. The point is that we all have certain predispositions, certain genetic traits, and so on and so forth. But at the end of the day, we have a morbidity curve, which is us. Now, what is health optimization? If the practice of medicine or sick care was the red lines, what we're talking about is the things that we can do to start changing the slope of this curve in our lives, right? And the things that we do in our life and our lifestyle and health habits and so forth start to give us the ability to flatten this curve out, which means we can stay healthier longer. And by the way, the shaded green areas represent savings to you as a consumer in terms of real money and savings to the healthcare system. And it's not just about us aging in as adults, which some of you are beginning that journey, right? But we have a problem in this country, right, which is that children are really not hitting their prime. We have an obesity problem. We have certain nutritional problems. So wouldn't it be great if we could change these curves like this? That's what health optimization is about, helping everybody be the healthiest that they can be. Now, why hasn't this been done? This hasn't been done because in the United States and every other population, you have what's called the upside-down pyramid. About 5% of the people drive 45% of the costs of the health care system, or really the sick care system. The next 20% drive 35%. If you're trying to manage a pool of risk, you're going to concentrate on who? The sick people, right? You're going to try to fix the sick people, take care of the sick people. But it's everybody else in the system that you can affect that can start to affect the curve and the slope that I showed you before. And there's never been a platform in healthcare technology to help the 85% of people who aren't very sick, who aren't spending most of their time in patient stay. Let me say it again. There's never been a system in healthcare to help that. The last company I built, by the way, Trizetto, took the healthcare sick dollar and distributed that to what you would think of as sick care: hospital, physician, pharma, and medical supplies. And that platform, we put 160 million people in the United States on that platform. Most people think about healthcare as sick care, right? Something's wrong with you. You present with a complaint. Someone with about 29 years of education diagnoses you. They give you a treatment regimen, you comply, and if you're a train wreck, you get case managed. The way we should be thinking about healthcare is to understand our health risks and benefits at whatever stage we're at, to manage the controllable health factors and the related costs that we have. And wouldn't it be nice to get rewarded for doing that, right? Everyone else in the system gets paid. Why not you as a consumer? So the old math basically took that dollar I just talked about and split it to these areas. In the Affordable Care Act, most people don't know, but when Senator Kennedy was still alive, I actually helped him write some legislation into that act that up to 30 cents of each health care dollar can be spent towards health improvement programs and incentives. So instead of just spending money on treating sick people, we can spend money on making people as healthy as they can be. By the way, U.S. healthcare spend is $2.6 trillion. Can anyone calculate 30% of that? Did I mention there's no platform to distribute that? That's what the math looks like, but I'm going to skip through it. One of the things I did in my book was define the concept of healthcare value. You see all this stuff in the newspapers and on TV about how bad our healthcare system and how low value it is. And frankly, it's pedantic nonsense, most of it. What we should be trying to do in healthcare is the same thing we do in every other industry, which is to drive higher value, right, at lower cost. So healthcare value equals the health status of you as an individual or us as a population divided by the cost of achieving that care. If we have great health at a low cost, that's very high value. If we have great care at high cost, that's okay value. If we have poor health at a high cost, that's lousy value, which is the way most people view the healthcare system today in the United States compared to most other places because the amount of spend is tremendous. Now, if you kind of put on a systems scientist hat, right, everyone talks about, we got to fix this healthcare across the population. You can't control populations. You can't do anything to a population, but you can affect individuals. So if you look at it from a behavioral standpoint, If we can affect individual actions, yours, mine, we can affect our individual health status and our individual cost of care. And this, of course, is what aggregates into having a profound effect on the entire population. And one thing I want to tell you about this equation, this is an equation of optimization, right? It's not trying to land on a spot, but we always think of the sick care system for the cost of care. So we're trying to prevent hospitalizations and try to use generic drugs instead. And these are not bad things, by the way. But there's all these little, almost no-cost, high-frequency things that we can do in our lives that elevate our health status, that can change the value of this. Simple, right? There's all this technology to help us and the healthcare system. Now, if you thought you were confused by how you access physicians and your insurance company and what's a copay and so forth, now we have all these other things coming into play. Reward systems, apps, devices like several of us here have on our wrists and so on and so forth. So how do you deal with that? Oops. So you would think we were on the right track, right? We've got all these innovations. You read about Fitbit and Jawbone, and Apple made a big announcement yesterday, and there's all these apps on our phones to count calories and so on and so forth. But frankly, it's cacophonistic chaos for a consumer to figure out how to navigate this world. New stuff's being created every day, and it doesn't tie to your health benefits, and it doesn't tie to your health costs, which makes it very difficult for population managers, i.e. your insurance companies or your physician groups or your local hospital that's partnering with you to control your health to help you manage any of this stuff. Well, big hassle. How do we solve that? So what we're doing at Welltok is we're converging population managers, you as consumers, and what we call this new healthcare consumer supply chain. The population managers are the people responsible for the cost of your health and sharing that with you as a consumer. You as a consumer have some basis of how you receive your benefits. If you're low income, you're on Medicaid. If you're high income employed, you're probably in an employer-sponsored plan. Once you hit 65, you're in Medicare. I'm not going to go into that right now, but suffice it to say that unless you can personalize the situation to how people get their health care financed, you can't really solve the problem. And then if you're one of these companies that's coming up with some new innovation to help drive people's health to greater heights through the use of technology, it's actually extremely difficult to get into market because you're really out there, you're selling at Best Buy. Who do you think's buying these things right now? The people that need them? Or the 11 or 12% of the people that are already self-activated, they're already aware, they already are working on optimizing their health. I'm going to go through this slide just in the interest of time. Okay, so here's how we solve this problem at Welltok. When you study computer science, right, you learn about some data relationships. One-to-one, one-to-many, and many-to-many, right? That's it. And then we have networking models, and social networking has taught us how to do hub and spokes and so on. And, well, that's great, right? But the truth of the matter is the way we experience healthcare is a few-to-one-to-many data model. What's our few? Well, each of us has a few things, less than a dozen, usually more than one. We have a health plan, we have physician and physician groups, or an accountable care organization. When you get your health care, whether you know it or not, there's a broker behind it. You might be employed, you might not. You might like Walgreens, CVS, or Rite Aid, et cetera, et cetera. But there's a few things that you as a consumer are making choices on, and every one of them has tried to own you in the past, but none of them own you. You own you, right? And so on the other side of this is that cacophonistic list of things that you can do. And so what our platform does is we know you're a very busy person, if I can advance the slide. And what we do is we link incentives and rewards to consumer action and behavior through what's called the Cafe Well platform. This is a platform as a service technology offering. Dean Stern mentioned that we invented software as a service in the healthcare industry back at TriZetto in 1997. This is the next step. Here's a diagram, pretty complicated. Let's move past it. Now, what I do want to tell you, though, is that to create a platform is pretty complicated. And so we've actually had to break it into a core platform for you to be able to be engaged as a healthcare consumer in general. We have what's called CafeWell Connect, where we take that cacophonistic picture you saw of all these vendors, and we curate those, and we put them into one single user experience, mobile and web, so that you don't have to navigate all over the place. We link it to very sophisticated incentives and design reward systems. And let me just say this, is that what one of you in this room may view as being a good incentive for optimizing your health may be very different from another. One of you may be motivated by watching your grandchildren grow up. One of you may be motivated by seeing your kids graduate high school. One of you may be motivated by winning the Boston Marathon. Okay, and there's a lot of range in between all of those things. And then the vignette I'm going to show you is CafeWell Concierge, which is the first usage of Watson, IBM Watson computing technology applied to healthcare, and the first commercialization of Watson. Okay, so CafeWell Core, what we do is we take input from a variety of sources, including you, isn't that novel, the consumer. We help figure out what behaviors you want to target, and we create what's called a personal health itinerary. So instead of going on a site trying to figure out how to navigate, it helps you and takes you through step-by-step where to go, whether it's mobile or web. This is a pretty novel concept, putting workflow into a web-based or into an app. Looks like that. Now, I just want to finish by showing you, instead of taking you through the base product, because this isn't a commercial presentation, I want to talk to you a little bit about cognitive computing meets healthcare today. This whole sick care system, ladies and gentlemen, that I've been talking to you about is built on codes of structured data that were put in place to pay bills, what's called fee-for-service medicine. So there's a diagnosis code, there's procedures, there's codes for each of the drugs that you might get, and so on and so forth. This is not a bad thing. But the way you experience healthcare, the way you would ask a question in healthcare is unstructured. It's random. It's got to be contextual. Okay, so when IBM came to us early in the development of the company and said, hey, we want to work with you. We have a tool here that won Jeopardy. Can you help us figure out how to make it commercially viable? I took a look at it and said, not really. I said, Siri's an idiot, and Watson is an unruly adolescent. And I'm not sure I want to train one of those because my daughters are raised. But in fact, we started working with them, and what we found out is in cognitive computing, Watson can not only read and understand material, Watson can learn just like a human being learns. You teach it, and then you ask it a question, and it gives you an answer, and you go, no, Watson, that's not the right answer. And then the next time, its confidence increases, just like a child. Okay, and we've learned how to train it. It's also spatial. It knows where it is, and it's temporal. It can figure out where it is in a time continuum. And so we thought about what are use cases where we can apply that to healthcare. So let me just finish by showing you one. So one of our offerings is what we call CafeWell Concierge. It's your mobile companion in your pocket that's your health partner, if you will. So you graduate from school here pretty soon, you go and get a job, and you have some health conditions because of family background. You arrive in Austin, Texas. Your name is Road Warrior, and because you put your phone onto airplane mode, once you take it off, once you land, Watson reaches out and says, hey, Road Warrior, welcome to Austin. I see you're staying at this hotel because I peeked at your calendar. I see that you're trying to watch your cholesterol and control your weight right now. So here's some recommended restaurants right by you, and here's some menu items in that restaurant. And that if you go into this restaurant, which, by the way, it will know because it's spatial, and you don't have to program it to figure it out, you'll earn some Cafe Well reward points. You go, great. So you go. That night you get back to the hotel and it says, by the way, your health plan, in this case Aetna, will reward you 1,000 extra Cafe Well points if you go and get your physical, which you should get every year, by the way. And would you like to add that to your health itinerary? Okay, you say. Now, this is hard to see, but this is what's called an intelligent dynamic health itinerary, where it's interacting with you, and when you respond to it, it adds something to the list, or maybe it adds multiple things based on its intelligence. All right, so a little time passes. You go to the doctor, you have your checkup, and then Watson knows that you did for a variety of reasons. I should say one thing, by the way. In Cafe Well, you are anonymous. You are an anonymous username, HIPAA compliant, HIPAA protected, only if you choose to expose your identity for earning rewards or points, in which case you're only giving them the rewards or points. But nobody is tracking you. No big brother going on here. Anyway, Watson reaches out to you, Cafe Well concierge says, hey, congratulations on getting 1,000 points. You're in the double bonus round. How did your appointment go? And you go, well, it's kind of lousy. I was told I have pre-diabetes. I don't even know what that is. Okay, in Cafe Well Concierge, based on the known characteristics of the person, we can give a 100-word answer, a 200-word answer. We can do it at the 6th grade level, at the 12th grade level, at the, and it can give you a snippet of information. And if you want to drill down, you can drill down more. And then you said, okay, Watson, I want to start making some changes. I don't want to become diabetic. What can I do? And it answers and says, hey, in your particular case, given what we know about you, calorie control and net carbohydrates is what you need to concentrate on. Would you like to update your goals in your itinerary? And so you say yes. And now reducing calorie intake, introducing whole grains and some other things pops into your itinerary. Very personalized. This is just your tool now. And here's how the story ends. The next time you go to Austin, it says, hey, Road Warrior, it's dinner time. I see you're staying at this hotel, blah, blah, blah. This time it shows you restaurants and menu items, but you can see that instead of showing just fat and cholesterol, it's showing you net carbs or the ability to look at carbs and proteins. Okay? Do you like that vignette? There's never been anything anywhere close to this that links your health and the personalization of your health to benefits and reward systems. I should say the punchline on this is based on the activity level. Road Warrior gets a $1,000 reduction in their insurance premium, a waiver of preventative of co-payments on preventative prescriptions, maybe entry or access into more holistic health or alternative health settings, which might be much more appropriate for Road Warrior than conventional medicine, or might be their choice, so forth. So I just want to conclude by saying that what we're converging here, right, is all the classic things: social, mobile, web, incentives and reward design. We're doing it in a manner that personalizes to you. But the big picture here, ladies and gentlemen, is we are taking this curve and all of these things coming onto the market that could help you. We're finding a way to connect them to you, to personalize them to you, to make an itinerary that's just for you, to create a reward and incentive system that's just for you. And in the last company I started, Trizetto, we knocked about 5% out of the cost of the healthcare system. I think we can knock 15 to 17% out of the cost of the healthcare system. Everyone can be healthier. Everyone can be happier. Everybody can save money. Thank you very much. Questions? Does anyone have a question? Yes, ma'am. Our customers, our initial customers were health plans. So United's, Aetna's, Cigna's, Blue Cross Blue Shield plans, entities that are trying to deliver care across the population and control the total cost of that care. And they're learning to, in the old days, which is now, the way they did it was by trying to control utilization or trying to really reduce the choices that consumers have, right? What this does is this takes people who are not necessarily sick, or even if you have a chronic condition, and it starts exposing you to a range of different capabilities that hopefully you yourself as a consumer will be motivated to carry out certain steps, gain access to things you might not have known about before. And for the first time, you're going to say, my health plan, instead of denying my claims and killing my grandmother, is actually helping be my health partner. Since then, we've added physician groups that take on risk. We've added community hospital systems that are trying to say we want to be more than just a sick care system in our communities. Retail pharmacy chains are talking with us right now. So almost anybody that partners you as a consumer in your health could be the people that pay. By the way, you as a consumer never pay for Cafe Well. Yes, Ted.
Are the health plans that worked with you originally still working with you?
Yes, we haven't lost any customers. Although, in fairness, we went into production, into the actual market just about 2.5 or 3 years ago. And our revenue is about 100x that first year. Yes.
When you asked Watson a question, you said that you have different level of responses, like 6th grade response and 12th grade response. Is this based off how you talk to Watson?
That's a great question. Initially, the Cafe Well application learns some things about you when you first register. And when your health plan invites you in, it knows certain things about you. So it knows your gender, it knows your zip +4, it knows if you have, if you're an adult, it knows if you have family, if you're a child, it knows if you have siblings. So it takes an educated guess at what your probable level of language proficiency would be. As you interact with it, it learns, and frankly, you can tell it. It'll ask you a question, say, do you understand this, or should I say it a different way? And it'll adjust. Yeah. Yeah. Right. It's not us opening our APIs, it's them. It's all these single-point solutions, whether it's Fitbit or Jawbone or Apple or Nike on the devices, or condition management programs that you may have never heard of, like D-Life, which is a diabetes program, or Propeller Health, which is an asthmatic and COPD. It's them opening up their APIs to us. We contract with them. We develop pricing with them so that we can take all of this entire ecosystem through and put it up for one single price for the whole package, so that whoever sponsors the consumer doesn't have to kind of get nickeled and dimed. Does that make sense? There really is no differentiation in data from devices. You're going to hear a lot. Let me just make a pithy comment, which is, you just saw Nike get out of the fuel band business. They got out because it's a race to zero. These devices, guys, are not differentiatable, and other than style, we've all watched Apple use style to try to keep price points in devices, but other than style, the cost of collecting data in these devices just goes down and down like long distance minutes. Well, you authenticate the results because via Bluetooth or some other methodology on these devices, you can get a closed loop system built, right? But other types of things, it's not about being a cop and watching everybody's moves, but it's about knowing what their level or frequency of interaction is on something. That's good enough, right? Because they have an incentive or reward to engage. We can actually do rewards that are based on outcomes. I don't like outcomes-based in healthcare. Healthcare's been trying to do outcomes-based for the last 30 years. It's not that it's all bad, but there's a lot of things going on in our health that just getting engaged will make you healthier. One more question? Or?
We'll have to take the rest after the...
Okay. Thank you all.
Thank you.